Hello, we're here to share some thoughts about stepping into the role as a new consultant. And my name is Kathleen Sullivan. I am one of the senior coaches and career coaches in the professional support unit. I'm delighted to be here today with Dr. Alice Mann, who is a consultant in anesthetics and pain management. Hi, Alice.
Hi, Kathleen. Thank you for inviting me. I work at the North Middlesex Hospital, which is based in North London.
So I've got a few questions for you. And really just to kick off with, what would you say that you know now that you wish you had known back then when you were starting out as a new consultant?
I wish that at the time I was less scared, and because it is a quite a scary transition. And I think that if I had known then I would have been able to approach my transition into a consultant level more confidently. And I now when I look back, I think of it a bit like when I was studying GCSEs and A levels, and I was living at home, and all I really did was study in the academic sense and nothing else. And then I went to university and I finished that. And when I when I graduated and got a job, I had to live on my own. I had to work and I had those sorts of responsibilities. And and it was different in the way that I was using my learning and my knowledge and the kinds of things that I had to deal with. And um, moving from being a trainee and on a training program into a consultant job is a bit like that transition when you finish your teaching and you move out and you go to work and you live on your own and you have to manage your own household budget. So it's a lot like that, and but on a different level. The other thing I would say is that you have colleagues and you should ask lots of questions. I think I was quite scared and it felt like the buck stopped with me and I should know everything, but actually you don't know everything and there's so much to learn in a different sense. So don't be afraid to ask questions.
Fantastic. And I think, that's kind of moves us on to the second question that I wanted to ask you. And so, what are some of the key pieces of advice that you would like to give to trainees who are preparing themselves for the new consultant role?
I think because the consultant role is very different from being a trainee in the sense that you are managing a service, um, it, and also you are in complete control of your own job plan. So it's very important to work with managers, and I wish that was the other thing I paid more attention to management training. So build relationships with the managers, the operational managers like service managers, general managers, and because when you can shape the service the way that you want, you improve the care that you give to your patients, not just the patient in front of you that you're treating in that clinical setting, but also the whole local population. And I think that that's one thing that I realized when I became a consultant, that the leadership isn't just about leading your department or the team that you work with, but it's also on a wider level and could be in a sort of local area as well.
I think that's really useful tips. And I think the last question, I think you've kind of answered it because it was really about, I wanted to know from you, how can trainees prepare for those extra leadership responsibilities and management responsibilities that come with the role?
So I think there's lots of opportunities for trainees to take on uh, like trainee rep roles, so their leadership roles. And I think they're really important because they help you understand the processes of sort of how say like working with managers and uh, making things happen, dealing with problems, which is what all leaders do. So I think those kinds of roles are really important. So you attend meetings, learn how to chair a meeting, maybe being part of a working group, or some kind of quality improvement work. Yeah. those sorts of things are really helpful experiences.
Oh, you've been really helpful. So thank you so much for your time today and taking time out from your busy schedule. And yeah, really, really glad to be speaking with you. Thanks so much, Alice.
Thank you, Kathleen.
Yeah.
Thank you.
Okay. All right. Thank you. Bye.
Bye. Thank you. Bye.